Good afternoon, everybody. My name is Dr. Christina Johnson. I'm a family medicine physician and the Atlantic Medical Group Health Equity Lead Physician. Each year, we highlight several important medical issues and clinical conditions for which we as an organization are committed to applying the equity lens. That is, we want every patient to receive the care that meets their unique needs and which achieves the best possible outcomes. Our primary focus today is maternal health in New Jersey. New Jersey ranks 36th nationwide for its high maternal mortality rate, with 46.5 fatalities per 100,000 live births, and Black women are 7 times more likely to die in childbirth here than white mothers. In response to these dire statistics, a number of statewide initiatives have been developed and enacted to collect information on patients and outcomes, to provide education to clinicians and patients, to reduce complications during pregnancy, and to increase awareness of all the factors which contribute to these statistics. On Maternal Health Awareness Day in 2019, First Lady Tammy Murphy launched Nurture New Jersey, a statewide awareness campaign committed to reducing maternal and infant mortality and ensuring equitable care among women and children of all races and ethnicities. In January 2021, the First Lady unveiled the Nurture New Jersey Maternal and Infant Health Strategic Plan. Today, we brought together a panel of clinicians and experts who are on the front line of this strategic plan, state leadership, physicians, and doula who are actively engaged in their daily work in reducing maternal mortality. Our clinician participants are involved in direct patient care with education and community outreach, and they are also leaders and participants in collaborative statewide efforts at the institutional and community levels. Our panelists today include First Lady Tammy Murphy, Dr. Lisa Gittens, Professor of the Division of Maternal Fetal Medicine at Rutgers, New Jersey Medical School and Director of Obstetrical Services at University Hospital. She's also Vice Chair of the New Jersey section of the American College of Obstetricians and Gynecologists. Dr. Fatima Naqvi, obstetrician and gynecologist in the Atlantic Medical Group and participant in the Atlantic Medical Group Women's Health Work Group. Erica Pulliam, a certified doula affiliated with the Birth Equity Alliance in New Jersey and the founder of Partum Tribe, an organization normalizing support for wellness and recovery of postpartum patients. She's also a recent awardee of funding from the New Jersey Equity Alliance for her program. And Dr. Judy Washington, Associate CMO of Atlantic Medical Group and the Women's Health Coordinator for Overlook Family Medicine. And we're going to start our discussion today with First Lady Tammy Murphy. Thank you so much for being here. We talked about the launch of the Nurture New Jersey in 2019, and despite the challenges of a global pandemic, in 2021, you launched the Nurture New Jersey plan, and that promoted an extremely ambitious goal, and that was reducing by half maternal mortality within 5 years and ending the racial disparities associated with disparate mortality outcomes. And we welcome you now to provide the foundation and the framework about these important efforts for our discussion today. So you'll just have to turn on your microphone.
Does that work now?
You're
okay.
Yes,
Let me try again. Good afternoon, everyone. Dr. Christina Johnson, thank you for that introduction. I am thrilled to be here today to kick off Black Maternal Health Week, and it is my honor to welcome all of you to Atlantic Health's Black Maternal Health Panel. Today's panelists are experts in their fields, and I am grateful to have their voices and input as we work to solve New Jersey's maternal and infant health crisis. Through Nurture NJ, we are on a mission to completely transform our state's maternal health landscape into the national gold standard for care, a mission that will require the collaboration and partnership of all of us. I am thankful to be able to share that over the past 5+ years, I have seen nothing but urgency, resolve, and eagerness to work together in support of our mothers across our state. And in fact, now as chair of the National Governors Association Spouses Program, I've begun to see that same commitment spreading all across our nation. This movement started first with mothers themselves, those who really courageously shared their stories of loss and grief, near-death experiences, and all too often the experience of just not being listened to. These women were disproportionately mothers of color. In New Jersey, as you just heard, a Black mother is almost 7 times more likely than a white mother to die due to pregnancy complications, and a Black baby is nearly 3 times more likely than a white baby to die before his or her first birthday. There is no question the root cause of these health inequities is systemic racism. That is simply unacceptable. I mean, this is 2023, and we should not be losing a single mother or baby in childbirth. In response, I'm proud to say that Nurture NJ's work has taken an innovative and broad approach to understanding our maternal health crisis and identifying solutions that get to the heart of the cause. We began locally by hosting events we call family festivals. One important way we can improve the lives of our moms and babies across the state is ensuring that families are connected to the programs and services that can help them thrive. I often refer to our family festivals as a triage for our family's most immediate needs. These events have a job fair meshed with a block party feel and bring state, county, and local resources directly to the communities in need. Since holding our first event in Paterson in 2018, I am proud to share that we have hosted a total of 16 festivals and helped over 6,000 families access various resources, ranging from doula care to child care to housing assistance and much, much more. I also would like to share that our next family festival will be held in Salem City on May 20th, so please use your network and help spread the word. While our family festivals serve as essential resource hubs for new and expected mothers and families, transforming New Jersey's maternal health landscape requires deep structural changes and a blueprint to get us there. As Dr. Johnson mentioned, in January of 2021, my office released the Nurture NJ Maternal and Infant Health Strategic Plan, our roadmap to making New Jersey the safest and most equitable state in the nation to deliver and raise a baby. It was written by a team of experts, all women, and the majority of them women of color, following over a year of in-person and virtual meetings with our departments and agencies, health systems, physicians, midwives, doulas, community organizations, and most importantly, of course, mothers and families. The strategic plan is designed to make transformational change in a system that has historically failed our mothers and babies, especially our Black mothers and babies. Accordingly, the plan requires all sectors, health, education, housing, business, government, criminal justice, and more to play an integral role in its realization. To date, I'm proud to say we have completed or made headway on over half of its more than 70 recommendations, and I'm thrilled to share a few more details about some of the most exciting recommendations within the plan, in my opinion. First, our Universal Nurse Home Visitation program is the most robust in the country and will ensure that every new parent, including adoptive parents and those experiencing the heartache of a stillbirth, will receive up to 3 in-home postpartum visits with a nurse. Anyone who has had the experience of bringing home a new baby understands how challenging those first few months can be. So the presence of a trained nurse to assess the health of mom and baby and ensure that the family has all the resources they need will not only bring peace of mind and comfort, but will also catch complications as early as possible, literally saving mothers and babies' lives. Along similar lines, I am also thrilled to share that we were the second state in the nation to expand Medicaid coverage to 365 days postpartum, and the third state to cover doula care through Medicaid, and specifically community doula care, because we know that culturally appropriate care can greatly reduce disparate health outcomes. These, for me, are incredibly common sense policy changes, and yet because we are leading the charge to enact them, they are also seemingly groundbreaking. Just as exciting and even more groundbreaking is our Trenton-based Maternal and Infant Health Innovation Center. This center, through cutting-edge research, data analysis, and innovation, will truly be a one-of-a-kind hub for developing groundbreaking solutions to our maternal health crisis. It's designed to create innovative models of care and policy that will transform maternal health care locally in Trenton and across our state. Perhaps most importantly, the center will be able to continue our vital work long after the Murphy administration. And ultimately, we look forward to sharing our best-in-class policies, programs, and innovations nationally to improve maternal health care for every mother and baby across our country. And I'm thrilled to share the New Jersey Economic Development Authority is making significant progress in bringing the center to fruition. Last week, the EDA issued a request of qualifications for 3 anchor tenants to lead the center, including a healthcare services provider, an institution of higher education, and a Trenton-based multi-service organization. These 3 lead entities will work collaboratively to provide services to expecting and new mothers and babies, advance the growth and development of the perinatal workforce, and deliver policy, research, and innovation focused on eliminating racial disparities in outcomes. And indeed, if there's one common theme in all of our work throughout every effort of Nurture NJ, it has been collaboration and partnership. Beginning with the mothers who raised their voices together to elevate this issue, this movement has brought together countless organizations, advocacy groups, government agencies, elected officials, professionals, and really just concerned citizens, all who continue to work together, and the vast majority of whom are women. While we still have a long road ahead of us, I am really thrilled to share that our work is beginning to pay off. According to the March of Dimes report card, which was released in November, of the 53 states and territories evaluated for maternal health, 47 declined, 1 stayed the same, and just 4 improved. Kansas, Montana, North Dakota, and yes, New Jersey. This marker is a testament to the transformative work we have done over the past 5 years and to the incredible outpouring of support we have seen literally up and down the state. So as we recognize Black Maternal Health Week, I want to thank you all for the opportunity to share this message, as well as your commitment and partnership on behalf of New Jersey's mothers and babies, especially our mothers and babies of color. Conversations like today's are essential to raise awareness, elevate the voices of Black women like those on today's panels, as well as identify challenges and solutions. So as we continue our work, we are constantly reflecting and assessing the effectiveness of our policies. So I really welcome the contributions of today's experts, and I'm grateful to be able to count all of you as partners. Our work is beginning to move the needle, and together we will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you so much for having me.
First Lady Tammy Murphy, I want to thank you so much for presenting today our keynote and framing our discussion, starting with the ground up in the community and actively listening to our community members to develop policies and practices which can literally change the lives of the communities that we're serving in New Jersey. I want to thank you so much for that work and for inviting this collaborative spirit. And thank you for your time. I appreciate it.
Thank you.
Thank you. Okay, in keeping with what Lady Murphy mentioned about data, research and data, I'm going to shift our discussion to the emphasis of the Nurture New Jersey plan on best practices for clinicians, both for data collection, risk reduction, and care coordination throughout the course of pregnancy and after. And we'll start with Dr. Gittens. Dr. Gittens, cardiovascular conditions and hypertensive disorders comprise most of the causes of pregnancy-related mortality. And you're part of the Maternal Learning Collaborative for the New Jersey Quality Improvement Program, and this is a statewide effort that aligns with the Nurture New Jersey plan and supports improvements in care quality and outcomes in maternal health. So for both patients and clinicians who are watching today, what are some of the ways in which you've been able to address and reduce hypertension for your pregnant patients and increase awareness within your organization as it addresses this issue?
Thank you so much for inviting me to this forum. I will tell you that when I discuss racial disparities in maternal health with my ACOG colleagues, both in New Jersey and across the nation. There's an outcry, and it's recognized that these disparities are not biologic, but rather products of systems. So there's a movement, and we are all part of it, has a life of its own, and it can't be stopped. The New Jersey Quality Improvement Program focusing on maternal hypertension is really critical for several reasons. One, hypertension and cardiovascular disease are leading causes of death of women nationwide, and they cause more deaths than actually cancer combined. And rates of chronic hypertension are rising in the United States, and they're particularly higher in Black women. And reasons for this are multifold, but stress is really a factor, and it's measured biologically by something called allosteric load. So the New Jersey Quality Improvement Collaborative is really a multi-pronged approach to addressing these untoward outcomes to Black women related to hypertension. But I'm most excited about a few of the following programs. One, the program encourages collaborative work. So it requires us, and those of us who work in labor and delivery units and birthing hospitals, to work with our emergency rooms and our frontline workers to establish protocols for appropriately assessing blood pressure in a timely fashion, appropriately treating it. At University Hospital, my emergency room colleagues enthusiastically embrace learning these safety protocols, and they actually really want to help. The program also encourages mothers to speak out, and this is so important. We learned when Serena Williams talked about not being heard during her birthing experience where she was having a pulmonary embolism, that Black women have not historically been listened to in the healthcare environment. But the program encourages not only women to speak out, but healthcare providers to listen to them. So I myself have personally witnessed the growth of patient agency, and that's transformative because Black women have historically not been listened to in the healthcare setting. And women know their bodies, and when we listen to them, we can provide better care and save lives. The program also encourages engagement, and that's between patients and families, communities, doulas, midwives, healthcare workers, community health workers, faith-based organizations, and not-for-profit organizations as part of the team. And so these are our patient advocates, and educating them about maternal risks related to hypertension can save lives. It's the doula that might encourage the mom who has high blood pressure postpartum, but is afraid to leave her baby to go to the hospital. It's the grandmother who notices a droop in her granddaughter's face that might get her to the hospital so she can be treated and evaluated for a stroke. And the program also demands the engagement of organizational leadership. And this, I think, is so important and really transformative. When we talk about social determinants of health, we need to think about discharge planning from the hospital. That historically focused on the baby. Does the mom have a car seat, a crib, and diapers? But now it's recognized that it's equally important to assure that the mother has appropriate follow-up. If she has hypertension, does she have access to a blood pressure machine, transportation to get back to the hospital for her postpartum care? If she requires a specialist, a cardiologist, or a pulmonologist, does she have access? And can she see that provider? Does she actually understand what happened to her if she has to deliver prematurely because of a hypertensive disorder of pregnancy? Those 3 or 4 days in the hospital are her most important days of her life, and she needs the tools to thrive. So the program encourages organizational leadership to deploy strategic use of social workers, case managers, navigators, visiting nurse services, and we have seen tremendous change related to this. We've seen incredible improvements in our postpartum follow-up rate because of these endeavors. The program also encourages postpartum follow-up rate beyond that delivery episode. And that's really important because 53% of maternal deaths occur in the postpartum period. That's when the patient's out of the hands of the obstetrical provider or the midwife, and they may be seeing their primary care provider. So as much as we can engage primary care providers to be part of the team, that is a really important endeavor. And at University Hospital, we have also, and in many organizations, have encouraged this primary care transition and primary care follow-up. And lastly, I would say that the New Jersey Maternal Mortality Review Committee recommends collaborative work and communication between providers as a way to save lives. New Jersey is a small but beautiful state, and women move from one county to another county. The mom in Newark goes to a farm in Morristown. The mother from Morristown visits the Prudential Center, and at any given time, they can require to access the healthcare system. So as providers share information across healthcare systems and enable patients to move around the state, we will have better outcomes. So this program, as well as the Nurture New Jersey program and the Quality Improvement Program, are testaments to these endeavors. So thank you for inviting me, and Black mothers, this is your time. This is your movement.
Dr. Giddens, thank you so much for those important and informative comments. We're going to switch now to some information from the 2016 to 2018 New Jersey Maternal Mortality Report. It cited the lack of continuity of care and care coordination as the top contributing factor in 75% of Black, non-Hispanic women who experienced a preventable pregnancy-related death. And here we'll switch to Dr. Nafi. Please share with us how within your organization, remote patient monitoring during and after pregnancy increase patient access and how it improves care continuity throughout the pregnancy journey. So that's, prenatal, postpartum, consultation visits, and lactation support.
Absolutely. I just want to take a moment to say, again, thank you for inviting me on this wonderful panel where we're discussing a very important topic that's near and dear to my heart. I just want to kind of echo the previous speaker's thoughts that, the pandemic has brought about many changes in our medical care, but especially it has been kind of not revolutionary yet, but it has really brought about a valuable option, which is the teleprenatal care. So I'm going to walk you through essentially what we do in my practice. Literally, we practice telehealth constantly. And it starts by essentially the patient comes in for their confirmation of pregnancy. This is an in-person visit, but during this visit, we have already started screening our pregnant women for any sort of high-risk factors, sort of setting the stage for when the patient moves to the next setting, which is where she interacts with our nurse. Now, this is a virtual platform. The nurses essentially screen the patients for their past medical history, their family history, social history, which gets done in every visit. But here, our nurses also screen all our pregnant patients for the social determinants of health that Dr. Giddens was alluding to. We screen them, we highlight what their needs are or will be during the course of their pregnancy. We teach them about mental health resources. We teach them about, if they have food insecurity, if they have intimate partner violence. It is all about screening and addressing right with the patient right then and there. Let's take the example of high blood pressure and pregnancy. We know, let's say if my patient comes in and she's already diagnosed with it, we will screen her. We will highlight the importance of low dose aspirin. We will assess if she has a blood pressure cuff or not. We will ensure that she is enrolled in one of our 2 platforms that we have and that we can offer to our patients within our institution. These platforms are actually, I know there are many, many technologies out there currently, but these are important because it allows the patient to not just have resources within the palm of their hand, education, classes, connections to the community-based organizations, doula network, breastfeeding, partner information, classes for them. It's all in the palm of their hands. Once they've been enrolled, essentially, we provide them with using one of these 2. If they need a blood pressure cuff, it gets sent automatically to their house. Our nurses teach them how to download the app, how to enroll them, and how it's important for them to take their blood pressure and how we can keep up with it and on a daily real time and discuss it when they come in. These nurses' visits kind of allow also to generate other consultations that may be needed. And here, maternal fetal medicine, genetic counselors, all of them are on a virtual platform. This is all about patients, their busy schedules, hectic lifestyles. They may be working night shift. They may be working from 8 to 8. They really don't have time. So it's really driven and putting the patients in control of their pregnancy journey. And that journey doesn't end with the birth of the baby, as Dr. Gittin said. Postpartum is the 4th trimester, we say. My goal in my office is always to prepare our patients, not just for their antepartum care, but also for their postpartum journey. I worry most about the postpartum period, as all my patients will tell you. I want them to design a team, and I say that to them because, as highlighted, up to 1 year, maternal death can occur from complications of pregnancy. And I'm kind of glad that my patients, and I practice in the state of Jersey, that provides postpartum coverage, meaning with insurance backing, providing these resources that the moms need. But more importantly, it allows them to connect with their primary care doctor too, which is the bridge that needs to happen between the OB provider and then handing off a patient who's experienced complications to their family doctor so that they can continue to be vigilant about their health and stress nutritionally, whether they need to do a healthier lifestyle. Across the country, we know there's maternity care deserts, right? There are hospitals that have closed down across the nation that were providing obstetrical care. There are no OB providers, there are no birth centers. And in these counties, it's essential to have telemedicine, teleprenatal care, so that the patients can access it. And this goes across the board, for our obstetrical and GYN care. Women need to, this is, as Dr. said, this is the time to do it, to take this momentum and to push forward for the changes that we need to accomplish. So once again, thank you. But this is how I do it in my practice, day in and day out. This is what the QIP-NJ MLC has taught us, is actually putting it into practice. So thank you.
Thank you so much, Dr. Naqvi. And I know that our community participants are learning so much about how to get connected, what to look for in connecting to an obstetrician's office, and to stay connected throughout the course of their pregnancy. And that leads us right to our discussion with Erica Pulliam. I appreciate your presence here today. She's our certified doula and affiliated with the Birth Equity Alliance in New Jersey and the founder of the Partum Tribe. And we invited you because multiple studies show that doula care before, during, and after pregnancy can lead to lower rates of maternal and infant health conditions and complications, fewer preterm births, and lower cesarean section rates, as well as higher rates of breastfeeding. And so for our participants who are interested in doula care, please share with us how doulas partner with pregnant women, pregnant patients, and their families during the pregnancy journey, and how this helps to lead to these important outcomes.
Thank you, Dr. Christina Johnson, for having me on this platform to talk about this health crisis. So what my counterparts I said prior to, all this like hitting home, especially when providing doula care and the concerns that the patients that we see are having. So if a person is looking to receive doula care, so let's start with what is a doula. So we're professionally trained individuals that provides emotional, physical, spiritual, and education support to the birthing person and their family. So how do we support the family and their needs? And those services take place, like we said, before, during, and after birth. And then I want to state that the doula is not the medical professional. So they're really bridging the gap. How do they connect to those services that they may need? So they can reach out to, so through New Jersey with what First Lady Tammy Murphy has brought about in this plan, it has been created where there are community partners like doula agencies that are reputable that you can register with, right? So if you're a doula and you want to be recognized through the Medicaid system, there's agencies such as Health Connect One, agencies such as XYZ Village that's recognized in that health system that you can register with. So let's just say somebody that's interested in doula, they could contact the Department of Health and say, hey, I'm looking for a doula. How can I connect? At that time that you'll be entered into like a intake will be taken from you. And also you'll be partnered with somebody that represent, who you could connect with, because it's all about connection. We're not just sending the doulas out to say, here's the family for you to support. You want to make sure there's a connection. There's a trusted community partner. That's the reason why we're seeing a decrease in the numbers, and also people feeling like I could talk to my doula if I'm having a headache today. And I may not call that provider that I didn't trust yesterday, or they said something to me where they didn't listen. I know I may could pick up the phone and the doula could listen. And even though we're not a medical provider, if you're having that headache and you call and say, I'm having that headache today, what do you think I could do? You could say, okay, if the blood pressure cuff was issued, let's see if you're using the blood pressure appropriately. What is your reading? Are you taking your readings regularly? Also, when we talk about the doula care, I like to say, especially during the postpartum period, you want to mother the mother, right? Because the baby is here, the mom's hormones have shifted, and it's kind of like everybody's focusing on the baby needs, but what are the mother needs? What is it that she needs? And that's how the Partum Tribe was birthed, because it's like a lot of times we have that support system, and the support system may be around for a week period of time. After the week, what happens, right? And I have learned in the Black and Brown community that sometimes we don't always like to ask for help, right? So it's like, how do you build that tribe where you could connect to that can go in and provide those services you needed? That tribe may not always be a family member, but it may be community partners. Who can I reach out to? So calling the Department of Health, you could get started to with your application. Also, there's private sector. So you could go to the birthing center. You could talk to your doctor. How do I connect with a doula? And to get that ball rolling. So that's prenatal. What does that look like? So we could go in, provide that labor support. We could go in, we could set up the nursery for you just to make sure it's easy access. We could go in even to help you plan out maybe what the baby shower should look like, because we're so into gifting, but maybe gifting needs to look different. Who's dropping off meals? Who's coming that maybe that can pick up laundry and do laundry, a load of laundry for you? Who could do light housework? So shifting that thought process. What are some rituals you may have in your family that you want to continue and bring into your home during that time? The support partner. How do we prepare the support partner outside of the doula that's going into the birthing space with the individual? So, and the kids, if there's other children that's a part of this family dynamic, what does that look like? You're bringing a new baby home. How do we get that set up where there's a transition? And I always say we have to consider our NICU moms, because that's a different experience. Like, what does that look like for them when they have to go back and forth to the hospital and you have other children and the support partner is going back to work? What does that transition look like? So even a doula to be there and support the family around that is important. During the postpartum period, again, normalizing rest. And when we're talking about the perinatal mood disorders and anxiety, again, I have noticed speaking to Black and Brown moms, it's like, I was tired for a long period of time. Okay, can we name that thing? What was that? Is it postpartum depression? Is it baby blues? So understanding like what is happening, naming the feeling that you're experiencing and seeking the help. Because we know that the stigma that's attached to receiving mental health services is difficult in the Black and Brown community. So if you have that trusted doula that you can talk to and say, hey, it's okay to feel this way, and let's connect you to the appropriate services, it goes a long way. So I'm just grateful for this platform to be able to share how important it is to have the doula for prenatal, during your labor and the postpartum period, especially because we know it's not just the 6 weeks after delivery, it goes that whole year, and who's checking in to make sure that not just mom, but the family is supported during that period of time. So thank you.
Ms. Pulliam, thank you so much for those comments, because what you gave us was a picture of the holistic nature of the peripartum experience and what doulas are able to offer both for the patient and the family of birthing parents. And that kind of leads us to an overlap between what you've been discussing, what Dr. Nafi and Dr. Giddens have been discussing, and how patients are actually getting connected to care through insurance. And there's been some important shifts and changes that I'd like Dr. Washington to comment on. What should patients know about Medicaid eligibility redeterminations, and what will they need to know to maintain their coverage? And Ms. Pulliam kind of brought up some really good points regarding doula care, but if you have any other sort of comments or tips or tricks for patients to connect with doulas and access midwife care as well, please provide those comments.
Oh, thank you, Dr. Johnson, and thank you everyone for your comments, because they are so timely and really important to what's happening right now. Yeah, hospitals, we've been really concentrated on May 11th, 2023, which is the end of the public health emergency. And for us, that's really shifting what we're doing, rethinking our telehealth, and we've been concentrating on that. Well, what's gone under the radar and may not be emphasized is April 1st, 2023. And that's when the Biden administration really mandated that states do a redetermination of all of what I like to say our patients who are now on Medicaid or New Jersey family care. Mm-hmm. So why is that important? It's so important for you, patients, families, us clinicians to understand that patients need to do something that's really simple, but because they may not have been told, they may not be doing. The first thing is that in order to keep your New Jersey family care eligibility, you need to call and just confirm your most recent address, where you're living now, and also your contact information. Now, why is that important? It's because the state is going to be mailing out to you really documentation of your benefits. If you don't get that letter and you don't respond, then you have not gone through redetermination and you're at risk of losing your benefits. So if you haven't received a letter, all you have to do now is just pick up the phone. I went to the New Jersey Family Care site, and the most recent phone number I found is 1-800-701-0710. I think that's going to be an important number for all of us to remember and verify, and you just pick up the phone and call. Now, for pregnant women, because you're now pregnant, you do not have to go through that redetermination period now. But what I'm going to say is call, because once you have that baby, you get caught up in all the things at home, and you may miss that notification or forget to do that phone call, because once you go through the postpartum period and you have the baby, then you now have to sign up and go through redetermination. Unless you have a really good doula who's going to help you, or your clinician, or if your hospital system is going to give you that information at discharge. And I think it's going to be really important for all of us to collaborate and coordinate that care. So why is that important? Well, First Lady Tammy Murphy just gave us a list of things that are now going to be covered by your New Jersey family care, and also by other commercial payers, because the state has really started to really mandate this coverage. So what's the first one? Doula services. You can now access doula care. We, Atlantic Health, we are trying to push that, get educated on that, and help our patients access that. And I'm sure around New Jersey hospital systems are doing the same thing. Despite the benefits of doula care, only about 6% of births in the country are attended to by doulas. And so that is really saying that what's happening? Well, access, limited numbers of doulas. It has to do with coverage. New Jersey's breaking down that barrier, but more importantly, it has to do with knowledge, our patients knowing about these services and how to access them. The other thing that patients need to understand is how to access care from midwives. Now, that's important because with these new rulings from New Jersey, midwife care is going to be paid for on par with OBGYN care, but also that is limited by access. Nationwide, only about 9% of births are attended to by midwives. There are two types of midwives that are recognized. There's certified nurse midwives, which their certification is based on their academic training, and then certified professional midwives. And that certification is really based on competency. In New Jersey, only about 9% of births are attended to by midwives. And why is that? Limited access. Last count that I was able to verify, there are only about just over 400, 500 certified nurse midwives in New Jersey. That number probably is increasing, but there is limited access across the country and even here in New Jersey. A lot of it has to do with access to training for midwives, but also access to that higher level education, which unfortunately can be cost prohibitive. So what can we do as health systems? We can collaborate and we can really help educate our patients about the access, and also we can have an opening, embracing spirit for doula services, certified nurse midwives actually providing this care within our hospital systems and even within our outpatient settings. So thank you, Dr. Johnson. I hope that was helpful. And of course, there's lots of information and patients can always reach out to their insurance carriers that can help them navigate where they can go to seek the services. Thank you.
Thank you so much, Dr. Washington. And the thread throughout all of your conversation was getting patients connected and being aware of the services that are available to them. Now we're going to circle back to sort of the beginning of the conversation. And First Lady Tammy Murphy mentioned this, that, the beginning of these efforts started with understanding patients by listening. Through the Nurture New Jersey community dialogues, women reported dismissal in the face of expressed needs, excess clinical intervention if not indicated, disrespect in terms of their relationships and treatments during care, and disconnection to services and systems. And a thread throughout the participants in terms of the outside questions that were being asked had to do with this communication. And one of our attendees today, Dr. Shai Gavi, is the System Medical Director of AHS Hospital Medicine, and he is a healthcare communication specialist and expert. And we asked him to bring a very important topic to the conversation today. Dr. Gavi.
Thank you, Dr. Johnson, for the opportunity to participate in this critically important program. Dr. Gittens and Ms. Pullum, this question is directed at you, if I may. Clinician communication is an important skill, and active listening can increase understanding of the patient's clinical, intellectual, emotional experience, and their perspective. In your work and within your organization, what opportunities for clinician education are available, and what role does clinician education play in improving maternal health outcome? Dr. Gittens, would you like to start off in sharing your thoughts, and then Ms. Pullum? Thank you.
Yeah, absolutely. Thank you. I think clinician education is critical. And I think that there's no better way to learn that than at the bedside. And we need to start with our medical students early in their careers. So when I teach maternal health and maternal physiology to students who are never going to become obstetricians, some of them will be emergency room doctors, they'll be plastic surgeons, orthopedic doctors. I speak to them about listening to women because they will give you their diagnosis and they will lead you. And so I think that bedside teaching is really the most important. And because of the endeavors of Nurture New Jersey and all of the changes that have happened in the healthcare system, I myself have witnessed tremendous change. I can say right now that in New Jersey, Black women are from across the African diaspora, and we have patients that speak many languages. And there is not a day that goes by in that labor room that we are not on the phone with a language interpreter, helping that patient through that labor and the postpartum period. So I think that respectful care has to be modeled. There are organizations such as the Association for Professionalism in Healthcare. We need to encourage participation in such organizations and start with our early learners and carry it through, and we can see that change.
Thank you. Ms. Pullum?
Yes, agreeing with Dr. Giddens, what she's saying, like it does start at the bedside. And everybody who's going to interact with that patient while she's there, we even have to think about like the lactation consultants. Like what does that look like if mom is requesting to breastfeed and they're pushing like the formula on her instead of like sending in a consultant for her to go through the practices of learning how to breastfeed or making sure she has that pump, making sure she's heard during that time is important. So it had like Dr. Giddens said, I think it needs to start when you're in school and not when you get to the floor in the unit, to understand culture dynamics and different aspects of how that family dynamic may work. It's important.
Thank you.
Mm-hmm.
And this is a little bit of a surprise, but Dr. Gavi, we do have an extra minute or two. Did you have any other comments regarding the importance of clinician communication with birthing parents?
I mean, I think I really feel about the active listening. I mean, active listening is what we call really listening and understanding a patient's perspective. It's a lot different than just hearing someone. So really, the act of active listening, which is not necessarily just the content, but what the feeling is, the emotion, the perspective, right? It's a whole, it's very active. And so that's critically important.
Thank you, Dr. Gavi.
Thank you.
All right, so we're going to switch back to looking at our organizations as a whole and how our organizations are working together across departments, across disciplines to assess patient experiences and improve maternal health outcomes. And for this, I'm going to pivot to Drs. Nafi and Dr. Washington. Can you share with us, Dr. Nafi, what clinicians or teams, so emergency department, Dr. Giddens spoke to this as well, internal medicine doctors, family medicine doctors, OB, nursing, doulas, midwives, what do they need to know about improving the care and outcomes of birthing parents?
So it actually is the QUIP-NJ Maternal Learning Collaborative has been quite an experience for our institution and for taking what we're learning inpatient and connecting it to the outpatient world, right? So that journey continues. But in our institution, what we've learned by implementing this is that we're taking the data. Now, we've been looking at hemorrhage data, we've been looking at hypertension data, among other parameters, but to actually break it down and look at it from the lens of race, ethnicity, language barriers, to look at it in those terms, you glean a lot more information and you highlight which patient populations are really affected. And that's where the real work starts, you know? So for the past 6 months, we thought we were doing a great job and we're preventing hemorrhage and we're preventing hypertension. But we realized actually by looking at it through this lens that we have a lot more work to do. It is not over yet. It's just starting. And the next 6 months as the project comes and we're going to institute policies and procedures and protocol, it is very important to engage our colleagues. So we talk about education, right? We talk about, of course, the medical student education, but it actually starts with, earlier than that, educating the patient to advocate for themselves, to speak up, right? To highlight their concerns. So that's number one. Number two comes down to who are at the bedside, our nurses. We've got to teach our nurses how to educate our own nurses, right? So there's a process of teaching one another that has to be reframed. And then of course, teaching our colleagues, right? OB providers have to stay up to date, right? Because we do carry biases. How can we not carry bias? I mean, that's just, it is who we are, you know, and we are a product of the community, the culture that we were raised in. However, we have to be able to separate that and then provide the best care that we can, you know. The other thing is just even taking our ER colleagues at Dr. Gittins, you know, we have protocols in place as well. We have, you know, we have actually launched e-learning, simulations, all of that stuff to highlight it. But what we're doing at our institution is breaking it down by those terms that I just highlighted. At the end of the day, you know, it's the patient. I always say this, it is the patient that is the most important factor. Even in our discussion today, I am thinking of like a whole slew of my patients in front of me that are coming together, you know, and trying to think what I need to do. And I'm learning from this panel, like what messages am I going to take back tomorrow when I'm back in the office? So it is real. This is very real discussion and it needs to be highlighted every day. So that's what I do, and that's what we are doing at our institution, to use the data and how we can improve the patients' lives and their families. So thank you.
Thank you very much, Dr. Nafi. We're going to switch over to Dr. Washington because we're speaking to our community partners, we're speaking to clinicians now, and sometimes it's helpful to give a simplified message about what we can do, what we can all be on the lookout for. And you recently provided editorial contributions to an article on 5 ways that patients can optimize their health during pregnancy and some tips for clinicians as well. So can you speak to us about these important points and the importance of childbirth education and improving outcomes?
Oh, great. Thank you, Dr. Johnson, again. So, you know, reading through this article in its finished product, it really was these bullet points that we could really put out there to patients. First, get connected, get informed, get in tune, know the signs, and stay connected. So what does that mean for a patient? Well, get connected. You know, we forget when patients are coming into our office, this whole concept of what do you need to do to be healthy, preconception counseling before you get pregnant, and then once you get pregnant, what are the next steps? We as family physicians usually are that first line. If a patient's not connected to their OBGYN, as Dr. Giddens said, that collaboration of care, and then we can move the patient to where they need to be with that getting connected. We can even start prenatal vitamins, but my hope is in that preconception counseling, patient already has the prenatal vitamins, and we can help our patients get informed. Dr. Google is out there, the internet, families, so we just help patients really know the facts by giving them education throughout their, their time coming to us. And then helping patients understand that your body's changing during pregnancy and you need to stay attuned to what's going on and look for signs of changes. And also knowing the warning signs of cardiovascular disease, hypertension, blood clots. So just knowing headache, leg swelling, nausea, vomiting, abdominal pain, and cramping, that's not normal and you need to reach out to someone. And then stay connected. As we've said, postpartum care is important and now it's covered for 365 days. So you should be seeing your doctor. We're going to be reaching out to you and you need to get those postpartum visits. So for clinicians, what do we need to do? Counsel, listen, examine, be alert, and stay connected. So what does that mean? When, as I said, patients are coming into your office, do that wellness visit and then get them connected to prenatal care. You can be a resource for them and ensure that they get to where they need to go. You can pick up that phone and do that phone call for them. Listen to the patients. As Dr. Gavi said, that active listening is important, and you're going to be the first line for keeping the patient healthy throughout the pregnancy. And then examine. So look at yourself, look at your biases, as we've said, but also re-examine, as Dr. Naqvi said, your office practices, reaching out to the patient, ensuring your patient gets signed up for that remote patient monitoring and getting that app to make sure that they know how to use it and get access to really good education. And then be alert, that practice in your office. Patients calling with a symptom, listen, train your office staff to listen. And even in the hospital, that we need to listen to patients. If someone's reaching out and saying, I'm not feeling right, it probably means that something is going on that shouldn't be occurring and we need to intervene. So headaches, leg swelling, vaginal bleeding, not normal. Get the patient in. And more importantly, we, as the clinicians, need to stay connected to our patients. We're going to do that 2-day follow-up, making sure we get that phone call to the patient once they deliver, get them in the office for what they need to be followed up for, and get them connected to those specialists. That's all important, and that's what we need to do to ensure our patients stay healthy. Thank you.
Thank you so much, Dr. Washington. I wanted to round up our discussion this afternoon just by saying I appreciate the presence of all of our participants today, and I really do hope that our community members who have connected, who signed up for the presentation today, were able to learn some more information about the resources that they have, the access that they may have to doula and midwife care, how to connect with their clinicians and approach their pregnancies in as healthy a way as possible. And for clinicians, information about the importance of aspirin, as well as the importance of listening to our patients, actively listening to what our patients are saying, and that just these things alone can help improve maternal mortality in the state of New Jersey. So this afternoon, I want to thank everyone who's participated this afternoon. First, the First Lady Tammy Murphy and her entire team. Each of our panelists today, Erica Pulliam, Dr. Judy Washington, Dr. Shai Gavi, Dr. Fatima Naqvi, and Dr. Lisa Gittins. I'd like to thank the Atlantic Medical Group Health Equity Work Group, the participating work group that started with the idea for this panel and this discussion and helped support the work. To Chanel Roberts, our project manager, and I have to say that this would not have happened or occurred today without her input, assistance, and help. We'd like to thank the Atlantic Medical Group and Atlantic Health System leadership, as well as the AMG, including the AMG CMO, Scott Lauder, and the Associate CMO, Dr. Judy Washington, Stephen Sherris, who's the Executive Vice President and Chief Physician Executive of AHS and the President of the Atlantic Medical Group, Dr. Susan Matthew, the Executive Vice President and Chief Clinical Officer, as well as Armand Kinsey, Vice President and Chief Talent and Diversity Officer. For me, we'd like to give a big thank you to Krista Hill and John Seckel, again, without whom we would not have been able to have this conversation together. We'd like to thank our program team, Louise Gonzalez, who's been our PR manager, and the entire AHS PR team. To Kim Holloway, the marketing strategy manager, and the entire team at AHS Marketing. Matthew Marinello, our government and public affairs manager, and countless others for their hard work and support of this event. We'd like to let you know about some future events that we have coming up this year on Thursday and this week. On Thursday, that's April 13th, we have an Atlantic Medical Group continuing medical education session on maternal heart health. The title is Maternal Heart Health, a Disproportionate Burden on Black Women with Sound Solutions, featuring Dr. Rachel Bond. She's Assistant Director of Women's Heart Health at Dignity Health and the Chairperson of the Association of Black Cardiologists, as well as a Children's Committee National Spokesperson for the Go Red for Women campaign. She was also the Nanette Wegner Award recipient for her work in advocacy in women's heart health. We'd like to let you know about our top 5 campaigns and some of the things that Dr. Washington spoke to you about, the top 5 things that clinicians can know, the top 5 things that our patients need to know. Look out for that campaign. We'll be sharing that with our participants and ask you to share those top 5 with your contacts as well. On Tuesday, April 18th, the Atlantic Health System is having a sustainability awareness event, what clinicians and team members can do to understand sustainability and be aware of it and how it impacts health systems. Again, I'd like to thank all of the participants in today's discussion. I'll leave you with 1 extra minute for lunch or for rest, and to even just think about all the things we learned today. Again, thank you to all our participants, and everyone have a great afternoon. Bye-bye.